No doubt you all remember the hazy days in Perth when the city was left gasping for breath by that huge blanket of smoke from a burn-off somewhere down in the southwest. Now, air quality is something that most of us take for granted until it's taken away. And for most of us, that is a rare but periodically unpleasant experience. But for the people down in Kwinana, air quality has been a really long-running concern. Some residents have been campaigning down there for more than a decade to have authorities both investigate and hopefully address their fears of a potential link between what they see as poor air quality, driven by the high industrial emissions down there, and linking that to poor health disease rates. Now, last night, officials from the Department of Environment and Conservation shared the results of their latest air quality survey with concerned Kwinana residents. The study, the department says, brings good news. Local sceptics say it provides real few answers. But Peter Taylor is the manager of the DEC's Air Quality Management Branch, and he joins me on the line now. Dr. Taylor, thanks very much for your time this morning.
That's all right.
Now, some people in Kwinana have been campaigning on this issue for about a decade and a half, raising their concerns. Does this study really tell them anything that will give them comfort?
Well, look, you know, the study was, the report that was put out yesterday was over a 5-year period, and we've reported on the first 3 phases of the study. We're about to engage in a 4th phase of the study. The report shows that we've done a lot of measurements down there. We've measured quite a few different compounds and over a long period of time, and this was in consultation with the community and industry down there. We've looked at a range of different pollutants that might come from a variety of sources down in Kwinana. When we look at the data, so for example for nitrogen dioxide or particulates, we also measure at the same time background sites, and we can't find major differences between what we've studied in Kwinana and what we studied elsewhere in Perth.
Now, I saw in the executive summary, Dr. Taylor, that the summary says that the level of these air toxics, as you referred to them, was similar to elsewhere in Perth. So they're similar, but they're not the same. So is it a difference with a distinction without a difference, or is there a significant difference between what's down in the air in Kwinana and what I'm breathing here in East Perth, for example?
Sure. Well, look, every time we measure them, we try and measure them against a health standard. And what we found down in Kwinana is that they're well below any health standards. And the same goes for other places in Perth. Our air quality in Perth is generally quite good. So when we measure them in industrial areas like Kwinana, they're still very, very low. They're still much lower than the health guidelines. And when we do the averaging and look at how the distribution of the results, they look very, very similar to elsewhere in Perth. And we've looked at things like Duncraig, where there might be some haze issues, and in the Perth CBD, for example.
Now, there were 3 substances, I think, referred to in the report as being outside the health guidelines, rather. Can you tell us about those and their significance?
Sure. Look, there's a number of carbonyls, so something like acrolein, for example. And acrolein, the average topped one of the a guideline that showed that there might be some irritant levels. When we checked with the Department of Health, they've advised that the levels were not sufficiently increased to cause a health concern for the majority of people.
Does that mean that for some significant minority of people they would be a health concern?
Certainly that's a question for the Department of Health, but
they didn't make
acrolein,
didn't make that clear to you?
Well, they did. They've got these the levels that they look at, and they put a limit on for irritant levels, not for a general health concern. So, and when they bump up against those, it's a more of an irritant level. And acrolein can be found in a variety of sources. Most of it, what we tend to see, and especially those particular parts in Kwinana, is where we saw them when we did the back trajectories, came from smoke, bushfire smoke. So it is similar to what we might have found earlier in February with the haze that blanketed Perth.
So in layperson's terms, though, when you say the air is pretty much constant right across Perth, what does that actually mean? Does it mean that the emissions from the industrial plants down in Kwinana disperse quickly and become sort of at a negligible level, or does it mean that that is being spread right across Perth? How would you explain it to an ordinary person?
Sure. Look, when we look at these compounds, the compounds that we might be looking for in particular might come either from industry. What we generally look at is the air quality at Perth in the airshed in general, and the things that affect Perth as a whole tend to be things like smoke that comes from wood heaters, they come from bushfires, they come from any sort of wood smoke. In addition to that, the other things that might affect Perth generally would be vehicle emissions, and those are the sort of things that we're trying to understand and control for Perth as a general airshed. They don't necessarily come from the industry in Kwinana specifically.
You're on Mornings with Andrew O'Connor, standing in for Jeff Hutchison. I'm talking with Dr. Peter Taylor, the Air Quality Manager for the Department of Environment and Conservation, about the latest air quality study on the air down in Kwinana. Now, I know that environmental groups have raised concerns about the way air quality is being measured down there. I think specifically they've described it as being your methodology as being ad hoc and patchy, that you weren't consistent when and where you were doing this measuring, and therefore these results can't be relied upon. But I presume that this is done to some standard and some standard way of doing this. So can you walk us through how you actually did this and gather this information?
Sure. Look, we do all of our measurements to US EPA methodologies and Australian standards. The measurements that were done in Kwinana, we set up a group called the Kwinana Airshed Study Advisory Group, and that group consists of industry, it consisted of community members, and it consisted of a number of government departments. And everything that was done down in Kwinana, especially for Phase 3, was passed through that particular group, and everything was agreed upon in terms of what to measure, where to measure, and for how long.
Dr. Taylor, if I can just get you to stay on the line with us, we're going to be talking with Jane Bremmer from the Alliance for a Clean Environment, who also has a very keen interest in this issue. But I'd also like to know your view. The DEC says it's good news that there's no significant difference in the air down at Kwinana, the industrial hotspot of Perth, and Perth itself, so that we've got nothing to be worried about. But what do you think? Are you satisfied with the results? Do you live in Kwinana? Does this give you peace of mind and a sense of comfort that the air that you're breathing may not be linked to any health concerns that either you or people you know have? Or are you as concerned as ever? Give us a call on 1300 222 720 or send us a text on 0437 922 720. Now, Jane Bremmer heads the Alliance for a Clean Environment, and she joins me now. Jane, you've been following this issue very, very closely. You've heard what Dr. Taylor's had to say. What do you make of it?
Well, we don't have the same level of confidence in this report that Dr. Taylor has, and we think for some very good reasons. We're very concerned about the methodology that's been used in this study, and we consider that there are major data gaps in this study.
Now, he says it's being done to a standard, I think, set by the US EPA, he mentioned. Why doesn't that satisfy you?
Well, he might be talking about the methodology for actually monitoring the chemicals, but our brief look at the report today shows that there are major data gaps in the times that the monitoring was undertaken. I mean, there are up to 4 months in a row where there is no monitoring being undertaken at all. There are chunks of time when there are only monitoring for certain pollutants and not others. We also, it looks like a study that's been thrown together in an ad hoc way, because there's bits of studies from monitoring over the years sort of pulled together, but it's not a consistent approach. We don't think it's at the standard that should be afforded for WA's largest industrial precinct with a history of complaints in the area.
Okay.
We don't think it's of that sort of standard.
Look, I'll just put that to Dr. Taylor. Dr. Taylor, Jane Bremmer says there are gaps in your methodology, there are big time gaps in the sampling. How do you respond to that?
Sure. Look, Jane has a very good point. When we look at these, the three different phases, each of them were signed off and done. So the methodology for measuring it was done correctly. The times that they were studied was also ticked off under the Airshed Study Advisory Group, so everyone was aware, and there was opportunity for the community to add into that process and say when they wanted things measured and where. In addition to that, I think one of the issues might be the averaging time. So what we generally do is we put a sampler out and might sample over, say, 7 days. Now that might average over that 7 days. One of the issues that we're coming up with is that you can get short-term events. You might have an event, an odour, say, that might have a very short in terms of minutes. So what we're doing is we're using a new technology now that we're about to start in phase 4 down in Kwinana. It's called a FTIR, a Fourier Transform Infrared Spectrometer. We've currently got it deployed out in Midland. We're now moving it, when it's finished out in Midland, we'll be taking it to Kwinana and using it in Kwinana to measure very short events. So this has a 30-second averaging time. And so we might be able to see these very, very short events, and that will enhance what the first phase, 3 phases of this study have done.
Okay, Dr. Taylor, thank you. Jane, essentially this study seems to be conveying the impression to people in Kwinana that they are at no more risk living there and breathing that air than they are in the western suburbs. Do you accept that?
I certainly don't. And I think the people of Kwinana understand that when you look at the national pollutant inventory, okay, so all major industrial premises are required to report their pollution to the national authorities. When you look at the data on the national pollutant inventory, you'll see that there are 33 facilities in Kwinana that include alumina refineries, fossil fuel refineries and power stations, chemical manufacturers, pesticide manufacturers, cement manufacturers, metals refinery and a major port. Now we already know that some of those facilities have shown to have caused significant environmental health impacts in Western Australia, and I can point to the Alcoa Wagerup issue there, where it took an independent group of medical experts to identify that the emissions from that facility were in fact affecting the health of the community. I'd also raise the issue of Coburn cement, which did fall in part of this under this study. That doesn't seem to have been picked up, yet the government and the health department have confirmed that Coburn cement is causing public health impacts to the local area. And we certainly know about the dreadful public health impacts that were caused in Esperance and Geraldton through bulk mining ores being released to the environment.
It's very hard to establish the causal link, though, isn't it? I mean, I think in the case of Wagerup, what they established was a correlation, not causation. They said that people were sick and the refinery was there, but they never really figured out exactly how those two things were connected.
Well, the government and industry for a very long time claimed that Alcoa wasn't causing those health problems, but a group of medical experts actually confirmed that, and I think you'll find that there's a legal case pending now, and certainly the community around Wagerup are very certain that Alcoa. And when you look at you also have to, it correlates well with the occupational health and safety issues that are occurring in the industries as well, which correlated well with the impacts in the community. So there was a direct link between the symptoms and the health impacts of the workers at the facilities and how that correlated to the community. So we know, we've got that information. We've got all of these types of industries in Kwinana and more, and it's almost unbelievable to think that those same types of industries aren't releasing those same types of emissions and having an impact on the air quality and the health of the surrounding community. Certainly the National Pollutant Inventory would challenge, does seem to challenge some of the assumptions made in this Kwinana background air quality study. And I just want to quickly mention particularly the issue of bushfires and motor vehicles that have been blamed by this study for a number of the exceedances in Kwinana. The National Pollutant Inventory, they already account for bushfires, particularly in Kwinana in relation to benzene. And they have shown that the contribution of benzene in Kwinana is significantly higher than the contribution of bushfires. So it doesn't correlate well with the claims that are made in this study, particularly also for nitrogen oxide. You know, there's 8.2 million kilos of nitrogen oxide being released into Kwinana, and nearly 7 million of them come from industry, and only 450,000 from motor vehicles. So to blame motor vehicles or bushfires on the levels of pollution that are being recorded in Kwinana isn't supported by the data on the National Pollutant Inventory and that body of evidence. I also want to quickly add that the majority of the data that's is being used in this study has come from industry itself, and I would really challenge Peter on the claim that the community had confidence in this study. There were only two community representatives on this advisory group, and the group was heavily dominated by industry.
I guess it's one thing, Jane, though, to cast doubt on the source of this information. It's another thing to have specific information that would suggest that the information that industry has passed on is in some way inaccurate.
Well, when it comes
do you have any
public
specific
interest
information?
Issues, well, we have a culture in Western Australia where there are numerous examples of where it has taken community activism and independent scientific experts to reveal the true nature of environmental health impacts. It hasn't come from the regulators and it hasn't come from industry. So that's the context in Western Australia that we're considering this report. And I think that it's an important issue to consider in the context of a major report for the WA's largest industrial precinct and the assumptions that are being made about our air quality and public health impact. It's certainly, this report doesn't correlate well with the cancer statistics, which are well above the national and state averages also for the area.
Now, you're listening to Jane Bremner from the Alliance for a Clean Environment. She's talking about the latest air quality study that has been released by the Department of Environment and Conservation, talking about the air quality in Kwinana, where there have been long-standing concerns about the industrial emissions and their potential link to people's health. I mean, you mentioned cancer there, Jane. I mean, people obviously would be very worried about elevated cancer rates, but as you and I both know, there are a whole range of reasons why cancer may be clustered in a low socioeconomic area, and emissions may only be one possible and potential cause.
Well, I would argue that there are numerous international studies that describe and document the increased burden of cancer and death for communities that live around hazardous facilities and major industrial precincts. In the US, they call them sacrifice zones. We certainly have buffer zones around Kwinana. Why would we have those if there wasn't an air quality or environmental health burden in the area? There's numerous studies that link disease and chronic diseases to industrial pollutants. And then you could look at the occupational health and safety statistics, which clearly identify disease related to certain industries, particularly in the nickel refinery industry. They have strong correlations between sinus cancers and respiratory cancers and that type of industry. So I don't think it's fair, and I don't think the community would generally accept that you can have a major industrial precinct with all of these high-risk industrial premises all emitting millions and millions of kilos of pollutants to the atmosphere, and there's no impact. I don't think the community would believe that.
Jane Bremmer, thanks very much for your time this morning.
Thank you.